You're watching Fox 45 Morning News. All local, all morning.
All right, Tony, thank you. Coming up, millions of kids across the country play some sort of sport, meaning there's always a chance for injury. We have a doctor here in the studio to help you prepare your child for their upcoming season. You're watching Fox 45 Morning News Weekends. It is 7:47. Gorgeous live shot out there this morning. Get outside and enjoy. Maybe take up a new sport. More than 38 million American children and teenagers play at least one sport during the year. No matter what that sport is, there's always a risk of getting hurt. Dr. Kovacs from MedStar Sports Medicine is here to explain how to prepare for the upcoming season. And a lot of folks are preparing all summer long, so hopefully the kids are somewhat ready to go at least.
Yeah, we certainly hope.
Yeah.
Thanks for having me this morning.
Absolutely. Thanks for being here. So it doesn't really matter what sport you play. There are different things that you can do to kind of get ready. Should we start with the physical for our kids?
Yeah, I think that's a good starting point.
Okay.
And the sports physical is a little bit different than the routine physical that you might get at your pediatrician's office or your family doctor's office. A lot of the high points are going to focus on it being safe for that student athlete or that child or young adult to participate in whatever their specific sport is, but there are some general things that are going to be the same physical to physical. So the usual things that we're looking at are injury history, a history of cardiac disease in the family, or any recent illnesses or any other medical conditions that the athlete may have that could affect their ability to participate safely.
Sure, sure. So any kind of underlying condition that you need to be aware of going into it.
Absolutely. And most of the time, the students that we see at the middle school, grade school, high school, college age that we do these physicals on, and even at the professional level, most of the time we're going to have the ability to say, yes, it is safe for you to participate, but we may want to make some modifications. We may want to order testing of some kind. And the physical is a good way to do that in concert with the routine medical exams that you get from your regular doctor.
And this is a good time of year to do it, getting ready. Heading back in for those fall sports particularly.
Absolutely. And you need to do it, not the weekend before your sport is supposed to start, but ideally a month and a half or so before, because if there's anything that needs to be done to make sure that it's safe for that athlete to participate, you need to give a little bit of time for that.
Sure, then you'd have enough time. Anything parents should ask? Do you always think, gosh, I wish a parent would always ask me X when they're sitting in that physical, or a student for that matter? Well,
frankly, I think that it's great for the parent to even be there, which doesn't always happen. But the questions that the parent asks is really maybe secondary to just having a good overall understanding of where your child is with their health and with their fitness and what their participation in their sport has been. And there are some standardized ways that we go over that process.
Okay.
So there's a standardized monograph, as we call it, for the pre-participation exam, the sports physical, and that's something that's available free online. Anybody's pediatrician or family doctor or internist can download that form and have their athlete patients fill that out, and that gives you a good starting point to make sure that everything's
and then you're kind of pre-prepared. You're informed heading into that appointment.
Exactly.
That's great. Dr. Kovacs, thanks so much for being here. Hopefully folks will heed the warning, get out there and get those appointments booked so that you can make sure your student athlete is ready for that sport come this fall. Thanks for being here.
Thanks so much for having me.